All right, good afternoon. All about the penis topic really gets everyone in the room. I want to thank the scientific committee for having me here to share the work we've been working on for the last roughly 5 years. These are my disclosures. Research has been funded by the SMSNA as well as the Canadian Urology Association, and I have no relevant disclosures otherwise from industry. I'm going to quickly review basically what we've been doing over the last couple of years, trying to create a model so we can actually treat in vitro Peyronie's disease, and then a new treatment that we've also been working on since, as we know, things are a little bit different north of the border. So Peyronie's disease affects a lot of men. It has a lot of sexual side effects and a lot of mental health implications. But despite this, we really don't have great treatment options for this in Canada. As we know, XIAFLEX has been removed. It's pretty much eliminated most of our treatment options, leading patients either requiring surgery or using verapamil, which obviously is a very old treatment with reasonable outcomes, but not really giving a lot of opportunities for patients with complex diseases. These are the Canadian Urology Association guidelines for treatment of Peyronie's disease. And if we're looking for a cure, we've really eliminated kind of a lot of options. So we can treat the symptoms with NSAIDs. We can try, obviously, traction devices. And most of the oral agents have been kind of debunked. And in Canada, we don't really have intralesional injections. So this really came to, well, what can we do to actually make an improvement for our patients? This leads us to actinitin. So actinitin is a soluble protein and is found in kiwis. It actually has been shown to hydrolyze collagen types 1 and types 2, as well as fibrinogen. And it's been used in human in vitro models, as well as mice models in different disease processes. It's also an excellent meat tenderizer. And if we figure if it's good enough for your steak, it's probably good enough for your penis. So we've needed to find ways to how we can test this in humans, and we are very much limited in what our current options are with basic science models for Peyronie's disease. So there's a lot of limitation with the 2D models. There's really no standard 3D models to actually show plaque, and using animal models is historically not ideal because obviously the pathophysiology is different. So we've been collecting Peyronie's disease cells from plaques during surgery and then creating 2D and 3D cellular cultures. So using these cells, we're basically growing them in vitro, finding that they indeed do have fibroblasts, and treating them with TGF-beta in order to help the cell proliferation and create a stable scar. We are showing that we can actually get a lot of cellular proliferation as well as an adequate amount of collagen production. So these scars are actually producing collagen similar to what we would see clinically in Peyronie's disease plaques. But 2D cells are only so good. That's not really what we see clinically, and if we're going to figure out a way to treat it, we need to develop a 3D model. So previously, this has been presented earlier in this meeting, but we've taken our 2D cellular models and using a novel technique have basically been able to spin this down using circular motion and anti-gravity to create a sphere. And the sphere is actually a Peyronie's disease cell culture from human cells that is showing similar pathology as we would see clinically. So this is what our 3D model looks like. So you can see the production of collagen externally. You can also see the markers for fibroblasts. And so this is actually showing the disease process in 3D cells. And these are what we are now kind of trying to stabilize and use different patients to recreate these models and then use them for treatment. So when we've created our 2D and 3D cultures, when treating them with TGF-beta, we are showing the increase in collagen, which is what we should expect to see. We can see that we get that increase in cell proliferation. So during kind of the acute phase or the proliferatory phase, we can create larger cells. And then we're showing the same thing in our 3D cellular cultures. So we are able to reproduce these multiple different ways. And we're creating them so that they are actually stable and then able to be treated in the lab. So we take our meat tenderizer and we try to treat our 3D model to see if we can actually get destruction of some of these Peyronie's disease cells. In a simplified process, we basically take kiwi, we grind them up, we isolate the actinitin, and then we are treating the cellular models, both the 2D and the 3D models separately. So when our initial data, which I think we presented about 4 or 5 years ago at this meeting, we looked at using actinitin to treat the 2D models. And we have found at various concentrations in various cellular models in the 2D setting that actinitin, which is the collagenase, can actually dissolve the collagen in these models. We have found that kind of 10 milligrams per mil is the approximate dosing that we're using, because when we get beyond that, we start to see healthy cell destruction. So obviously that's not very good from an overall cell viability. This is the cell viability testing, so we're showing that beyond 10, we are starting to actually see that healthy cells are being killed as well, so that's obviously not going to be a very good treatment model for our patients, so we have to take that into consideration. So we're using the 10 milligrams per mil as our stable dosing, which we've been using to test our models. Then we are taking our 3D models, and we've been able to, again, reproduce similar data. We are looking at the actual collagen destruction, so it is a collagenase. We want to see if it can treat the collagen on the both externally and internally on our 3D models. And we are showing that we are seeing that success. So the actual percentage of collagen is actually reduced with the higher concentration of collagenase. We are also looking at what the size of our sphere is. So when we are treating Peyronie's disease, whether it be with Xiaflex or Verapamil, the shrinking down of the scar probably is going to give us some clinical benefit, because that's going to allow better tissue expansion with erection. And so we look to see if we can actually dissolve the size of these scars, not just get rid of the collagen. And we actually see a huge reduction in the total volume of the models as well when treating with collagenase. So this has obviously been very promising, so we've been kind of working towards this. There's obviously still a lot of unknowns before we can, start using this. So we are currently testing our model with various collagenases as well. We're using it also to test the effects of Verapamil, so seeing what this effect is actually like in the lab is what we're seeing clinically. We are continuing to use the actinitin, but we also need to make sure that the cell viability of the healthy cells is adequate, because it's obviously not going to be a very good treatment if it's affecting the healthy cells surrounding the plaque. And then we are hopefully going to implement this into either animal models and eventually human studies as a kind of a nutraceutical treatment that can be used. So in conclusion, we have developed stable 2D and 3D models using human tissue and then recreating this in the lab that have been stable and used for treatment. This is the first new treatment that might be available for Peyronie's disease since Xiaflex was introduced back about 15 years ago. And I've started telling my patients that maybe a kiwi a day will keep the Peyronie's away. So thank you, and I just wanted to let everybody know that this indeed is the weather currently in Canada. It is not snowing, and it's actually sunny and warm still, so thank you.